We got 73%.
Cheers, everyone.
Also, it was a 67-year-old postmenopausal woman. They've got this little mobile donating blood truck. On the MSK Derm Guide, this one is going to be amazing for your studying.
Good morning, everyone. First thing, always make your bed in the morning. Studies have actually shown that those who make their bed in the morning have a much more productive day, and it makes sense because you're starting off with doing something. This is your life and cleans your environment. I didn't iron my sheets like you see those videos on Instagram, but this will do. And now let's get changed and get ready for a day in the hospital. The first thing I'm conditioned to in the morning, coffee. Med student things, right? Cheers, everyone. Time to moisturize. So I'm just having a look to see what I'm rostered on to this morning. And this morning we are on GOPD, which is Gynecology Outpatient Clinic. I have done GOPD a few times now, and really you see varying presentations from irregular menstrual bleeding, painful periods, women closer to menopausal age and symptoms of perimenopausal and menopause, patients with fibroids, patients with postmenopausal bleeding, a various amount of presentations. So I'll be doing that in the morning. And then at 12, I have a CTG speculum workshop. So CTG is the fetal heart tracing, and speculum is that device that you insert into the vaginal canal where you can visualize the cervix, and it helps in various examinations, including the cervical screening test, the pap smear test. So we'll be doing that, and then this afternoon I'm going to be practicing some OSCEs with some friends at the hospital, because not next week but the week following I have my final OSCEs on Friday. There's 3 stations, 10 minutes each. I have a YouTube video where I do a vlog and I show you a little bit about the OSCE breakdown, but need to practice for that. And yeah, so let's pack up my bag and head to the hospital. Before I head into the clinic, I want to show you what I must have on my badge reel, and that is my OBGYN set. In particular today, I'm definitely going to be using this one a lot. So the abnormal uterine bleeding includes polyps, adenomyosis, leiomyoma, coagulopathies, ovarian dysfunctions, a lot of which we see in the gynecology clinic, as well as this one here, which is our gynecological infections, everything from Candida, bacterial vaginosis, I see your gonorrhea, chlamydia, and PID. So let's head into clinic and let's strap these on the badge reel. See you guys in a bit. Hey everyone, just got out of the gynae clinic. It's 11:30. And I'm just heading to go grab a quick coffee and a bite because I need that before my speculum CTG workshop at 12. But quickly while I'm walking, just wanted to go over a patient we saw. So it was a 67-year-old postmenopausal woman with complaints of abnormal vaginal bleeding. And she actually had an ultrasound done which showed evidence of intraluminal fibroids. Now we consulted her on a hysteroscopy, and then we're going to attempt to remove the fibroid.
But if there's any difficulties with that, there might need to be a hysterectomy done. We did counsel her as well on the need to biopsy the mass. Of course, it is most likely going to be benign, but we always want to be concerned of a leiomyosarcoma in this case. So yeah, I'll just gonna go grab a coffee. Staying caffeinated, of course. My order is an oat flat white. And we have this turkey brie bagel that looks delicious. It's good. Yeah. Something about brie cheese, cranberry, and turkey. It's different. Hey everyone, so they've got this little mobile donating blood truck. So I'm just about to sign up. They have it just outside of the hospital. I try to do this whenever I can. So yeah. All right, just finished the workshop and I'm tired from the day, but we have one thing left to do, and that's my UWorld block. Another day, another UWorld block. I'm gonna be doing 15 questions. So as you can see here, I'm in my OBGYN block, so I'm selecting that for now, and then I do all systems, and then at the moment I am doing 15 questions per day. So let's generate the test. So the key here is that antenatal steroids for lung maturity and lung protection are going to be given up to 34 weeks, as you can see here. Our tocolysis is going to be for up to 34 weeks as well. Penicillin is going to be all the way to 37 if we suspect GBS and have a positive culture, or if their status is unknown or they have risk factors like PPROM or prior GBS exposure. And finally, mag-sulf, which is neuroprotective in patients with preeclampsia or severe preeclampsia. We want to give that up to 32 weeks. It has the most evidence for neuroprotection. And I'll let you guys do this one in the comments. What can we give if there's an over-toxicity of magnesium sulfate? What can we give? What can we administer to reverse the effects of magnesium sulfate toxicity? And yeah, that's a little practice. I wanted to just make sure I had the timeline down for that. Just finished the set. See how I did. We got 73%, so pretty happy with that. There was a few questions on childbirth that I just need to brush up on, but overall, I'm pretty happy with that. And now it's time to select some Anki cards that I'm gonna have to do based on my incorrects. And I'm gonna head home. So, see you then. No excuses. No excuses. Secured the bag, everyone. Secured the bag. So we just got back from the gym, and before I absolutely devour this burrito bowl, I figured I'd show you what's inside. I get extra guac, of course, but while I eat this, I figured I'd answer a question that I get all the time, and that is, Jake, how do you manage being a med student, a content creator, prioritize your fitness and eating? And to be brutally honest, it comes down to time management and efficiency putting together a study plan, a fitness schedule, a meal plan that works for you, that you're happy with, that you're comfortable with. You know, every hour is maximized in my day, whether it be when I'm at the clinic or in the hospital, whether I'm doing study in Anki or building the books and guides for you or filming a video for you. Everything is maximized. I, of course, have to sacrifice things where, you know, I'm maybe not watching TV, I'm maybe not going out, I'm maybe not doing all these things, but I'm passionate about medicine. I'm passionate about delivering amazing study resources for you guys. And so that's what I prioritize, and that's what I want to get done. If I have time after that, then I'll go do all those other things that I love. But for now, I'm focused on med school. I'm focused on making content for you and making study resources and guides and, you know, OSCE things, all this good stuff for you guys. So now, no more waiting. I'm going to eat this and do some emails and reply to some people on the team. So talk soon. Putting in work on the MSK Derm Guide. This one is going to be amazing for your studying. Let's just show you guys a little sneak peek into some pages here. Osteoblast builds bone, osteoclast crushes bone. Look at these little memory tricks here. We have the P's of Paget, osteomalacia, osteoporosis, and osteopetrosis. This is all the work that I'm doing putting these pages together for you guys.